So there is now this video going around of people inside the United States who either have health insurance or they don't have health insurance, and they're going to a different country to afford insulin. Now, when you hear that, you're probably thinking, oh, they're going to Canada, right? And yeah, there are caravans of Americans that go to Canada every year so that way they can get insulin at a cheap price. But we're not talking about Canada. We're talking about Mexico. That's right, now we have Americans who live along the southern border going to Mexico to buy insulin. And in this video, this guy goes there and he gets a pen of Humalog for $17. $17. In America, that's pretty cheap, even with insurance. And there's another lady, she gets Norco, and her copay is like $40. And she bought a pen for like 17, $20. Her copay is almost $40 for a pen. Just imagine how much that would be if she didn't have the insurance, how much she would actually have to pay. And the lady who goes there all the time, I mean, she walks across the border, takes her like 10, 15 minutes to cross through it and get to that pharmacy. And she'll get $800 or $900 worth. So coming up on $1,000 worth of insulin in the US at least. But when she goes to Mexico, she gets for like $150. That's like an $800 difference right there. It's ridiculous. That is the point that we're at, to where we are leaving the United States. Well, we're crossing the border into Mexico to be able to afford insulin. And then we come back and we live here. Now, you'll hear stories all the time of people who come from other countries to come to the United States to get better care. Because when you look it up, we actually do have some of the best doctors in the entire world. Which, I'm not knocking that. That's great. Definitely, we need that. Like, that's a great bragging point, that we have some of the best doctors in the entire world. But we also have the shittiest health insurance in the entire world. I mean, when you go through the comments of this video, like, you'll see people, I can even pull some up right now, I'll directly quote them instead of just paraphrasing. Living in the UK, this sounds like a third world country, not America. I live in a border town. People fly to El Paso from different states in the country and travel to Juarez for cheaper dental treatment. One of my mom's friends went there for a knee surgery. People come to America from all over the world for the best medical care. Mexico, hold my tequila. As a person with type 1 diabetes, this infuriates me. Insulin is a prescription that I need to survive. The fact that our healthcare system forces people to pay hundreds of dollars is disgusting. And that's true. I'm not a diabetic, but my best friend for over a decade, he's got type 1. My grandmother has type 2. My dad has type 2. So, I mean, they need this stuff to survive, basically. And it's so expensive here, they really can't afford it, and it's ridiculous. We've been going to Mexico for dental. A family of 6 to fix all our cavities was $300 at the time, 2 adults and 4 kids. $300 for 6 people to fix a bunch of cavities? That's cheap. That is dirt cheap. Like, that's a steal. This is true. I live 10 miles from the border and get my dental work done there and medicine. My coworker just went to Mexico for a gastric bypass to save money. And we're in the north. I lived in San Diego for years. People have been crossing the border for decades to get their cheaper meds. Nothing new there. But their prescription laws are different, so folks were bringing back huge jars of amphetamines and barbiturates. I hated going there. It was so poverty-stricken, but now it looks just like the good old USA. So who's the third world country now? Cheers. Let's see. Regulations. Even Nicaragua, a tiny socialist country, has a Medicare for All system. Max Blumenthal did a great Twitter thread on this. I'll have to look at that. And there's a lot of people in here saying that the reason the wall is going to be built is actually because Big Pharma wants it built. Now, I'm not going to go that far. You know, that's a little too conspiracy theorist for me, but I can see where they can draw that conclusion, because, I mean, he is really wanting to build that wall to keep illegals out. But at the same time, it could be. Could be trying to keep us from Mexico so that way we can get cheaper drugs. Like I said, that's a little too conspiracy theory for me, but I mean, but that is the crazy thing. The fact that the United States, the richest country in the world, has to have their population travel to the north and the south of us into different countries. One people claim to be a shithole. Like Mexico is just a shithole. People would much rather go there to buy their insulin because it's cheaper there. And that's not how it should be. I mean, you gotta think, we are the United States. We are the richest country in the world. If you go on Twitter right now, I guarantee you 10 minutes ago, Trump just tweeted out about how great the economy is. When you have 30 million people without health insurance, and then you have another 11 million people who don't have good health insurance, and then you have 45,000 people die every single year from lack of health insurance, from lack of health care. You can't sit here and say that you have a great economy when the median net worth of the average American under 30 is only $11,000. Can you really say that we have a great economy? Now, unemployment is the lowest it's been in years, but can you really have a great economy if you still have an unemployment problem and you have a homeless veteran problem? How many is it? It's like, what, 50,000 homeless vets in the United States? That's not just regular homeless people. That's homeless vets, specifically. Now, I thought Trump cared about veterans. So, don't you think he would want to get them off the streets? We don't have a great economy. We really don't. We have a terrible healthcare system, too. We have a mafia-like middleman, basically. That's what it is. It's a private tax. It's a mafia. All these keywords, all these buzzwords that you see people using, it's all true. Because, I mean, it's ridiculous. I shouldn't have to pay these ridiculous expenses. Like, I shouldn't have to pay the health insurance that I do, and then can only go to certain doctors, only go to certain hospitals, still have ridiculous copays. Like, that's not how it's supposed to be. If I have health insurance, I should be covered, no matter what. I shouldn't have to pay out-of-pocket copays. I should be able to go to any doctor I want. I should be able to go to any hospital I want. But I can't. And that's ridiculous. We need a Medicare for All system. It's not socialist. Plenty of countries have it. Socialist countries, social democracies, regular capitalist societies, they all have it. I mean, we have public education. We have public police. We have public fire department. I mean, why do we have all of this that's taxpayer money? It's ridiculous to think that we would pay out of pocket for this. But then you look over here, health insurance and Humalog. Stuff that people need to survive. Because if you don't get your Humalog, if you don't get your insulin, you're going to fucking die. No, that you have to pay out of pocket, and you have to pay 7 times more than the rest of the world. But this over here, yeah, this is completely fine. These are 2 totally different things. No, they're not. They should be considered the same thing. Healthcare should be a right, especially when, like I said, when you need some of this shit to survive. Like, if you cannot live without this, if you go without this for too long and you fucking die, that should be a right. So the fact that we're having to use these for-profit health insurance companies as a middleman to try and get that for us is ridiculous, because they're charging us way too much money. They are profiting off of the deaths of millions of people. Okay, not millions of people, but still, they're profiting off of all these sick people and off of these dying people who need this care. And they don't care. That's all they want right there. It's all about the fucking Benjamins. It's what it's all about. All about them Benjamins. We need a Medicare for All system, and we need it now.